CCF is honored to meet the Urzynicok family. We were introduced to them by Dr. Pertillis, who is not here today, and I had the pleasure and honor of meeting the family earlier this year via Zoom, so I feel like we go way back, at least until February, I think. The story is unbelievable. Nicholas was diagnosed with osteosarcoma on April 23rd, 2018, 2 days after his 11th birthday. Enduring numerous surgeries, new diagnoses, and far too many setbacks, Nick is now concluding his junior year of high school. I don't think there's much more for me to say because he can say it all. His family, Frank, Michelle, and Katrine, who I have to add is working in Dr. Ladle's office this summer in your lab, correct? Is that, yes. So we have an incredible connection and community here. So I'm going to turn you over to Nicholas and his family, and please, please stay tuned. Thank you.
I'll start us off. So just telling a quick story from last Friday when I took Nicholas to one of his routine MRIs, and you know how these things start off. You meet an unsuspecting assistant at the beginning who's taking all your personal data, so name, date of birth, and then we get to the big one. Do you have any medical history? And we're like, well, you know, medical history is a bit of an understatement. How much time do you have? How much space do you have on your form? So we moved through this multifocal osteosarcoma thing with a bunch of complications and relapses quickly, because we know there's another big question to come, and that's the one of, do you have any implants? Sure, here's the parts list, you know. So it's just to say there's a lot that Nicholas has gone through, a lot that his team has done for him at Johns Hopkins, and just a tremendous effort and a tremendous thing that he's endured. And just one more quick story. When he was diagnosed initially at age 11, they had this pediatric program called Beats of Courage, where for every little injection you get, you get a little bead on a long string, and for surgery you get a slightly bigger bead, and so on and so on. And I think we started collecting those for a while, but after a few months we had to stop because the string was like 10 feet long already. So the past 5.5 years or so we've gone without that string. So luckily that last MRI was okay though. So at the moment he's NED, and he'll tell you a little bit more about himself.
Hello, everyone. It's an honor to be up here telling my story in front of all of you. And it's people like you why I'm able to stand here today and give this talk about my life. So before I start about my life after my cancer diagnosis, I'll start with who I was before. So as you heard earlier, I was diagnosed 2 days after my 11th birthday on April 23rd, 2018. Up until that point, I was always an active kid. I loved playing soccer, and it was one of my dreams to play for the U.S. national team in a World Cup. I also loved skiing during the winter, especially in the terrain park where I could practice tricks like rails, boxes, and jumps. I also loved regular activities like biking and running. Whenever I had the chance as a kid, I would always be doing something physical. I also loved traveling, although you can't see any pictures in the slideshow. Before my diagnosis, I had traveled to 6 countries across Europe and North America. All of this changed when I was diagnosed, though. All of a sudden, I wasn't able to do any of these activities that I loved, and I had to stop traveling. I was forced to get around in a wheelchair and crutches, but I don't like talking about this part of my journey, so I'll let my mom explain it a little further.
Hi, everybody. Thank you for having us today. As Nicholas and Frank have already said, we're really grateful to be here today and share Nicholas's story with you. I will talk now about Nicholas's path to diagnosis. As you guys already heard, Nicholas was an avid skier. He was actually an amazing downhill skier. We spent the whole winter leading up to his diagnosis skiing every weekend at Round Top, a little local ski hill nearby, and he was just tearing up the moguls in the terrain park. So when he started complaining of a sore left knee, we didn't think anything of it because he had been landing hard and just, we had to drag him off the mountain at 10 o'clock when they were like turning the lights off. So we just assumed, like most osteo families, that it was a sports injury and it would get better on its own. But a few weeks went by, ski season ended, and he was still complaining of a sore knee. So we took him to see an orthopedist. And as soon as they took the x-ray, they pulled me out of the room and said, we are about 99% certain that your son has osteosarcoma. And to say we were floored and devastated is the understatement of the year. Luckily, this was Dr. Lee, who is an orthopedist at Hopkins. Before he even came back into the room to talk to me, he had already called downtown to Johns Hopkins Children's Center and had appointments lined up for us the next morning. So the next morning, we met Dr. Christine Bertillis for the very first time, and she has been escorting us through this journey ever since, over 6 years now. So Nicholas has had so many surgeries. We've actually never counted them up until a few days ago. We did that while we were preparing this presentation. As all of you know, osteosarcoma is a very surgery-heavy cancer, and Nicholas tops the charts at 28 surgeries to date. We won't go into every single one because we'll be here all day. So I will now give you a very, very concise summary of Nicholas's 6 years of osteosarcoma treatment. I'm going to divide this into 4 parts: his initial diagnosis, his first relapse, his second relapse, and his third relapse. So as you guys know, he was diagnosed April 23rd, 2018 with multifocal osteosarcoma. So the way that came about was he'd had his port, he'd had an open biopsy, osteosarcoma was confirmed, his port was put in, we were about to start MAP chemotherapy, and Dr. Levin, his orthopedic oncologist, insisted that we get a bone scan before the first chemo hit his system. So Frank and I are in the room with Nicholas, and Nicholas is on the table, and we can see the scan. Like, we can see the tumor lighting up in his body, in his left femur, and then we notice a bright spot on his right tibia. And, we've been in this world for 48 hours at this point. I could barely look because I was barely holding it together as it was. And sure enough, there was a second primary tumor in Nicholas's right tibia. So that was even more devastating than the initial osteosarcoma diagnosis, as you can imagine. So Nick received MAP just like everyone else does with osteosarcoma. And as far as surgeries go, he had a double limb sparing surgery, received titanium implants in his left femur and right tibia, and a double knee replacement. And then he proceeded in between cycles of MAP to have open thoracotomies on both lungs. Nick got through MAP okay, and after that, Dr. Bertillis approached us with, in her words, an out-of-the-box option, and that was MEPACT. So we were completely on board with this, and she went through the very trying and rigorous process of getting MEPACT for Nicholas, and he went through all 9 months of those infusions as well. At the end of MAP, Nicholas was declared NED, so he was NED for those entire 9 months that he was getting MEPACT, and we had a really nice stretch of 2.5 years of no evidence of disease. Nicholas's first relapse occurred in October 2021, and that was found by Nicholas himself. We were on our way to wheelchair basketball practice, and I was driving, and Nicholas is like, "Hey, Mom, I have this new lump on my head." And, I have full body physiological panic attack reaction to this comment, which I'm, of course, doing my best to hide from Nicholas and keep us on the road. So, we park and getting out the wheelchair and all that kind of stuff. When I feel it, and it's a significant lump. So Nicholas rolls down to wheelchair basketball practice and forgets all about it. And I, of course, am immediately contacting Dr. Pertillis. So, as you all know, thus ensued a myriad of scans. Turns out that Nicholas had 3 relapsed tumors, one in his skull, one in his right iliac crest, and one in his right lung. All of those were resected surgically and successfully with good margins. And Nicholas received 10 cycles of ifosfamide and etoposide. Happily, when he had received 2 cycles of IE before the skull tumor was resected, and we were thrilled to learn that the tumor was 99% necrosis, which was way better than his necrosis on MAP, which was sort of in the mid-60s somewhere in one tumor and 70% in the other. So those were nerve-wracking 6 to 8 weeks, getting those first 2 cycles of IE into him and just hoping and hoping and hoping that it would work for him and that it would buy us some time to get those tumors out of him, all of which it did. So once he got through that, we were very interested in putting him on some kind of maintenance treatment to help keep this thing from coming back again. So we looked into clinical trials, and the clinical trial we decided to do was the cabozantinib trial out of Nationwide Children's Hospital in Columbus. That required us physically going back and forth to Columbus a number of times, and Nicholas absolutely hated taking cabozantinib. He had a myriad of unpleasant side effects from it, and it really affected his quality of life in a negative way, even more so than MAP and IE. So he was miserable on it, and about 8 months in, he was getting a routine PET CT, and a very small tumor in his left radius was discovered. It was biopsied, it was osteo. So he had no symptoms for this relapse, which was found in August of 2023. It was found on a PET CT scan. For this tumor, we opted to do surgery only. Nicholas, at that point, had been on systemic treatment for almost 2 years straight. He had lost a tremendous amount of weight. He was over it, to say the least. And so we felt that that was a realistic option at that point. So the radius tumor was resected, and that was with an allograft, replaced with an allograft. So then we went on to a very rigorous plan of scans. And unfortunately, Nick's third relapse was found in March of 2024 after a routine scan. Again, no symptoms. There was one tumor in his right lung. At the time it was found, it was still quite small, but was very clearly osteosarcoma. And so then we started the discussion, okay, we've used front line, second line, and third line chemos at this point. What's left? So Dr. Pertillis helped us weed through a myriad of clinical trials and other options. While we were dealing with that and thinking about it and meeting with people and asking a million questions, surgery was being organized for Nicholas to get that thing out. And this time we opted for robotic-assisted surgery to get that tumor out because it was in a really difficult place. All of his other 3 lung surgeries were open thoracotomies. So we got the tumor out, and in the end, we decided to start him on naxitamab. So he started that just a few weeks ago in May, and we're hoping to do 5 cycles of that. So despite all of the surgeries, treatments, and relapses, Nicholas continues to defy the odds and thrive, as you can see here. He's an exceptionally resilient person, as is our daughter. We're proud of both of them, more than we can possibly express, and we just love Nicholas's dry wit and sarcasm, which still has a tremendous amount of life and vitality despite everything that he's been through. So to talk about his life living with osteo, I'm going to turn it back over to Nicholas.
So my life with osteo may seem pretty similar to before based on these pictures. However, every activity, even as simple as walking, has its own challenges now and makes my everyday life much more challenging than before. Despite this, I still love any physical activities that I'm able to do, and physical therapy for almost 2 years helped me get back to a place where I was able to do these. I started to adaptive ski, which is just skiing but sitting down. And as you can see in the picture on the left, I traveled to Jackson Hole and Durango to do this in some cool places. I also still love activities like biking, and whenever I have a good opportunity, I'm always up for a good bike around the neighborhood. Once I regained enough strength and was in no risk of injuring a healing part of my body, I also started to participate in adaptive basketball and sled hockey. These are both adaptive versions of their respective sports, basketball and ice hockey, and gave me another way to physically exercise. It was also with osteo that I got into Formula One, which I love watching and playing on my gaming setup at home. Playing video games also became a part of my life with osteo, because I wasn't able to do a lot of physical activities or see my friends whenever I wanted to anymore. Video games gave me something to do and a way to stay connected with my friends. Although my life has undoubtedly gotten much harder since my diagnosis, I'm still finding the good in life and enjoying everything I can. I still travel every chance I get because I love seeing different parts of the world, and although osteo brought a lot of negatives into my life, it also brought a few positives. Most notably, it brought my Make-A-Wish puppy, whose name is Teddy, who came into my life because of osteo. He's a little corgi who's 3 years old and makes my life more interesting and happy every day. Thank you.
Thank you. In conclusion, I'd like to say a couple more words, if that's okay. We'd like to thank Nick's primary oncologist, Dr. Christine Fertilis, who is the leader of his vast medical team. And in addition, we'd like to thank Dr. Levin and Dr. Ree, who have both operated on Nicholas multiple times, as well as the multitude of other surgeons, specialists, and oncologists that have worked on Nick's case over the last 6 years. Words are not adequate to express how grateful we are to Dr. Fertilis. Not only is she a brilliant scientist, but she has the ability and the patience to explain every drug and everything that's happening in great detail until we completely understand how it works. And just for context, I have 3 degrees in playing the clarinet as a professional, and Frank is an aerospace engineer, so not a lot of biological science in Nicholas's parents' background. She and the team have always considered Nicholas as a person and his quality of life when guiding us in making treatment decisions. And the value of this cannot be underestimated. This is Nicholas's one life. His entire team wants him to have a life full of adventure, education, friends, success, and love, just as much as we do. Nick's team has continued to go above and beyond for him and our family time and time again. When Nicholas was diagnosed with multifocal osteosarcoma over 6 years ago, as I've mentioned, we were completely devastated. I personally did not know how to cope with such a poor prognosis and such an overwhelming treatment plan. So to quote Teresa Beach, who is an osteo mom, osteo advocate, and mom to osteo angel Daniel, where there is life, there is hope. So Dr. Ladle asked, where's the optimism? And I'm telling you, it is with the parents of these kids. Nick's team embodies the essence of this quote. They have never given up on Nicholas, and because of this, he is here today, NED, thriving, and living his one precious life. So we, the parents and families of childhood cancer patients everywhere, thank you all so much for your research. Please never give up on our children. Know that even though you may not see us that often, we are forever grateful for your work, and we remain hopeful that treatments will become kinder and more effective because of it. So thank you very much.